Hey guys, welcome back to my YouTube channel. Like I promised in my last video, I said I was going to make a video on how to interpret your blood pressure readings. So that's what we're going to be talking about today. So before I jump in, don't forget to like and subscribe to our YouTube channel because we're going to be bringing more and more educational videos for you to at least gain some basic knowledge about your health. Now, let's start. So I'm going to go back to the basic anatomy and physiology of the heart. First of all, a lot of people go to the doctor's office, check your blood pressure. Some don't even ask, what is my blood pressure? Or even if they're being told, they have no idea what it means. Now, what is the heart? I'm going to make this very, very simple. The heart is the size of your fist, okay? It's a muscular organ that pumps blood throughout the body, through your blood vessels. Now, the heart goes through a cycle of contraction and relaxation. It's an alternating cycle. It contracts, it relaxes. It contracts, it relaxes. Contraction is when blood is being pumped out of the heart so that it's supplied throughout the body. Relaxation is when the heart muscle relaxes and blood is being filled up into the heart muscle before it contracts again to be pumped out of the blood. Now, when you check your blood pressure reading, you have two readings. You have the top number and the bottom number. The top number is called the systolic blood pressure. The bottom number is called the diastolic blood pressure. Now, the systolic blood pressure indicates how much pressure your blood is exerting against your arterial walls when the heart contracts. So the systolic number is how much pressure occurs when that contraction takes place, and that contraction, like I said, is when the blood is pushed out. Now, diastolic is how much pressure that is exerted against the arterial walls when the heart muscle relaxes. That's when the heart is being filled up with blood. Now, let's talk about the numbers. Now, there are different categories when it comes to your blood pressure. So the normal blood pressure is less than 120 over less than 80. That's normal. So you see your blood pressure, the top number is less than 120, the bottom number is less than 80. Now, when your blood pressure is elevated, that means the top number, which is a systolic, is between 120 to 129, and the bottom number is still less than 80. So that means it's just elevated. Now, stage 1 hypertension is where your top number, which is the systolic, is between 130 and 139, and the bottom number is between 80 to 89. So at this point, the doctor might recommend lifestyle modifications, you eating healthy, you exercising, or they might prescribe antihypertensive medication depending on your increased risk for cardiovascular disease. So they have to look at the whole picture before the doctor determines what treatment plan to take. Now, stage 2 hypertension is when the top number is 140 or higher and the bottom number is 90 or higher. At this point, you have to be prescribed antihypertensive medication. Then the last one is what we call hypertensive crisis. Hypertensive crisis is when your top number is higher than 180 and the bottom number is higher than 120. Now, some people at this point, they might not even have any symptoms. If you notice that on your blood pressure machine on the screen, my suggestion is wait a little bit, wait like 5 minutes, retake your blood pressure again. If it's still high, you don't have any symptoms, go ahead and contact your medical provider and see if you can they might have to add another medication, or they can figure out a different treatment plan for you. But then if you check and you see that you are symptomatic, meaning you start having chest pain, shortness of breath, you're having back pain, you feel numbness and tingling down your arm or your jaw, you have changes in your vision, this is an emergency. Call 911 or let somebody drive you to the emergency room immediately, because it might be signs of you possibly having a stroke. It's an emergency, so don't take that for granted. Now I have explained what those numbers mean. We're going to put the table so that anytime you look at these numbers, you know what you are looking at. Thank you so much. The next video I'm going to make is on how to check your blood pressure reading. A lot of people are not using the blood pressure machine correctly, or they might not even be using the right cuff, and they're having inaccurate results. So watch out for my next video. Thanks for joining in. I appreciate it. Thank you. Bye.